This video offers an overview about how to operate Aisys CS2, including self-test, added features and safety. Here are some of the main components of this anesthesia machine. Let's now explore the physical switches located on the user interface monitor. Audio pause button. Temporarily silences alarms. Hold for 2 seconds to cancel the pause. Start end case button. Press to start or end a case. It helps document the anesthesia session correctly. Screen lock, unlock button. Locks or unlocks the touch screen to prevent accidental touches. Ideal during cleaning or when no changes are being made. Home button. Press to clear all open menus and return to the main display. Com wheel or rotary knob. Turn the knob to scroll, press to select and confirm settings. For system setup and power on, start by attaching the gas supply hoses to the wall outlet, then plug the system into an electrical socket. Ensure the circuit breaker, located at the lower back of the unit, is switched to the on position. Next, switch on the scavenging system from the main wall panel, and confirm that the bobbin indicator is floating. A green LED next to the power switch indicates that the system is receiving AC power. Now power on the system by sliding the switch from left to right. The display screen will activate in approximately 45 seconds. To check the oxygen cylinder, turn the cylinder valve anticlockwise and verify the pressure reading on the screen. Ensure that the suction system is functioning properly. This anesthesia machine is intended to be power cycled and fully tested once a day. Once you complete the checklist, you can perform the full test of the machine. The full test consists of 3 components: the vent and gas test, the circuit leak test, and the O2 cell test. Each of these tests can also be run individually. The vent and gas test consists of 2 steps. Follow the on-screen instructions to start the first step. This will take approximately 25 seconds. Once it is complete, follow the on-screen instructions again to begin the second step, which takes around 5 minutes. After that, to do the circuit leak test by following the on-screen instructions like putting the bag to vent switch to bag, set the APL valve between 30 and 70, etc. The circuit leak test will take around 1.5 minutes to complete. Now, moving on to the oxygen cell test. This test checks the functionality and accuracy of the oxygen sensor located in the breathing circuit. Just for reference, this is where the oxygen cell is located in this anesthesia machine. Follow the on-screen instructions, and once the oxygen percentage reaches 21%, press done or press the knob to confirm. Once the test is complete, a green indicator on the left side of the screen will display the self-test status. You will also be able to see the date and time of the last completed test. Here you can see an additional test called the low-pressure leak test. It is available only as an individual test from the individual test menu, and is not included in the full test sequence. To perform the low-pressure test, attach the test bulb to the common gas outlet and squeeze it until fully collapsed. Hold it for 10 seconds. If the bulb stays collapsed, the system is airtight. If it rain flats, there is a leak. To start a case, press Start Case to open the setup menu. You can choose between default or custom case settings. Default options include for preset case types, with predefined values for patient weight, age, and apnea alarms. Enter the patient's age and weight. Then press Start Anesthesia to begin the fresh gas flow. You can adjust all parameters either using the preset Quick Select menu on the left side of the screen, as shown here, or, if you prefer not to use the presets, you can use the main rotary knob, turn it to manually adjust the parameters, and press the knob to confirm your selection. To select other gas with oxygen, like air or nitrous, press the gas setup menu and choose from the drop-down list. You can select the oxygen percent and flow rate here using the quick keys, or adjust them with the main rotary dial and confirm your setting. Press the close button once you're done. End-tidal control allows anesthesia providers to set target values for end-tidal oxygen and anesthetic agent. It automatically adjusts fresh gas concentrations to quickly achieve and maintain those targets. To activate, access the ET control settings from the main menu. Set your target values for end-tidal oxygen and anesthetic agent. ET control will then automatically adjust fresh gas concentrations to achieve and maintain your targets. These are the different ventilation modes available on the Aisys CS2 anesthesia machine. Mechanical ventilation starts by switching the bag vent switch to the vent position. Ventilation begins using the previously configured or default settings. To change the ventilation mode, press Mode, then select the appropriate setting for your patient. You can adjust parameters like tidal volume or inspiratory pressure using the main rotary knob. Alarm messages on the Aisys CS2 are color-coded, red, yellow, and blue, based on their level of importance. Red indicates the highest priority and requires immediate attention. To temporarily mute system alarms for 2 minutes, use either the physical audio pause button or the on-screen soft key. To adjust the alarms, select Alarm Setup. From the Primary Limits section, choose the alarm limit you want to modify. Use the rotary knob to make your adjustments and press to confirm the changes. For additional settings, select the More Limits Options tab at the top. When you're done, press the close key or home to return to the main screen. To verify the status of the last self-test during an ongoing case, simply press the System Setup key and select Checkout History. This will display the most recent self-test results. To view additional system settings or diagnostics, press the Next Page key to navigate through the different interface screens. Use the Trends menu to view patient trends and set the time scale. There are 3 different views of trends. Trend information is saved every 15 seconds for the most recent 24 hours. To access lung mechanics data, select the Spirometry button. There are 3 types of spirometry loops available: pressure volume, flow volume, and pressure flow. To store a loop to memory, select Save Loop. Up to 6 loops can be saved for comparison. The saved loop timestamps are displayed in white above the waveform area, making it easy to identify and review each saved loop. To temporarily suspend gas delivery during a case, press the Procedures key, then select Pause Gas Flow. This will stop the flow of fresh gas for 1 minute. You can resume gas flow at any time during the pause by selecting Restart Gas Flow. Under the Procedures button, you'll find the option for vital capacity. This feature allows you to deliver a single, controlled pressure breath during mechanical ventilation, without changing multiple ventilator settings. You can adjust the pressure hold time, and PEEP values as needed. Then, press Start Vital Capacity. A notification will appear on the screen indicating that vital capacity is active. To stop the procedure at any time, simply select Stop Vital Capacity. To use the machine in monitoring only mode, tap the Procedures menu and select Monitoring Only. You can also access this option through the Start Case menu. Just select Monitoring Only and confirm your selection. At any point, if you need to begin anesthesia delivery, press Start Anesthesia and confirm to activate the machine. To start a timer, press the Start Timer button located below the Procedures key. The Aisys CS2 has an optional single-port auxiliary oxygen flow meter for nasal cannula or mask use, separate from the main system for independent delivery. Set the ACGO position to direct fresh gas to the ACGO port, which can supply an auxiliary manual breathing circuit like a Mapleson or Jackson-Rees circuit. The alternate O2 control automatically activates during certain system failures. It can also be turned on manually by pressing the alternate O2 on/off button. Then, adjust the flow between 0.5 and 10 liters per minute. A notification will appear on the screen. Set the agent to the desired concentration. To stop, press the button again and confirm on the screen. To end the case, set the bag vent switch to bag and select End Case. Choose End Case now from the menu, or press the physical Start End button to place the system in standby.